Okay, so what we are ready here to announce. We are here to announce that Interior Health Authority has made the decision to go ahead and apply for an exemption under Section 56 of the Controlled Drugs and Substances Act for an application for a supervised consumption in a mobile service. So Interior Health will be applying for an exemption to Health Canada to offer supervised consumption services through a mobile.
What does that mean?
So, as you know, Interior Health has been engaging with different stakeholders in a conversation about offering supervised consumption. Supervised consumption is one of the services that can be offered within the scope of harm reduction services. There is harm reduction services offered in the interior already. So in Kelowna, for example, Outreach Urban Health, Positive Living Resource Center offer harm reduction services. So what we've been talking about for the past 6 months is offering supervised consumption, which is a service that allows people who use drugs to come in and use drugs under supervision, and that's because of the crisis that we are facing with overdose deaths. It's felt that that service will save lives and will engage people into services and will also decrease the amount of drug use that is being happening in public spaces. We have a good indication that there is drug use in public spaces, so supervised consumption will serve that. The mobile services includes offering supervised consumption inside a mobile, which could be a van or an RV or any device that could be mobile. We are still in the planning stages, but the decision is that supervised consumption be offered in a mobile space, not in a fixed location, as we had consulted the public about. We had proposed that perhaps the Friendship Center in Kelowna was a location that we were considering. Well, that's not what we are going to be applying for. We are only applying for the mobile service. So this is only an application for an exemption. It doesn't mean that the service is going to be up and running next week or tomorrow. This is an application for an exemption, and we need to wait for Health Canada to respond to that application and see if they would approve the service.
Why a mobile as opposed to a fixed?
Well, a mobile has several advantages. This geography here in Kelowna, we have seen that the hotspots for drug use is more than one place. So downtown Kelowna, Rutland are areas where drugs are causing deaths in a higher number. So a mobile would provide the benefit that could be used, could move from one location to another. In addition to that, we have to think that in the Interior Health Authority there is other towns and other places where we could deploy the mobile if needed. So we still haven't engaged in conversation with other towns, but that's some of the advantages of a mobile.
What do you say specifically why you guys, because technically you had announced the 2 mobile, one in Kelowna, one in Kamloops, in addition to the standalone. So essentially you guys have axed it. Can you talk more about why? Was it the public response to it, or?
Well, we had a meeting today in Kelowna with some stakeholders that included the mayor, RCMP, ambulance services, MLA, and so we today talked to them as we have been talking along the way, and it crystallized during the consultation process that the mobile would be the most appropriate service to provide in Kelowna.
What do you expect your hours of operations to be?
I just want to clarify that our original statement was that we were reviewing for one or the other. It was never intended to be both. And that was what the consultation process was about, was determining. Right now, the hours that we're looking at are 12 noon till 12 midnight, a Tuesday to Saturday.
Is that the same as the other site?
It's an extension. Right now, the hours are noon, 12:30 to 7:30.
Till midnight.
Do we
Correct.
have a timeline on the application? You said it was in the application process.
Yes, so the application, we are still gathering the documents for the application. The application is very onerous, as you probably heard me say before. There is lots of pieces that go into the application, and we are in the process of gathering all of those documents to be ready to apply by the end of January.
So to clarify, you haven't actually submitted the application.
We haven't yet submitted the application, but the decision has been made that we are going to submit an application, and that's a big step because that means that we are beginning to plan for the service if Health Canada approves the application.
The decision to go with the mobile and not do the permanent site, how much was that made over pressure from businesses or other members of the community to not have that permanent site at the Friendship Center?
Yeah, well, we definitely listened to the stakeholders. That's why we consulted with them. And the truth is that most people supported the mobile. So that's one component of the, in the consultation process and what led to the decision. Other parts of the decision are also based on need and what is, what can be provided, how many fixed locations can, the health authority support. Is a mobile perhaps the best way to go to accommodate, the different locations at where we are seeing overdose deaths?
How many mobile sites do you expect to have up and running?
Like how many stops for
Yes.
the mobile? Well, that's still, in working process. We still don't know I couldn't tell you exactly where the mobile is going to stop. I can tell you that the places or the locations in Kelowna where we are seeing the most deaths are downtown Kelowna and Rutland. So I would expect that the mobile would stop at those locations. But the specific location where the mobile is going to stop, there is, requirements like we need to be able to have power at those locations. So there is a lot of logistics, and that's, Deb's group is looking at every detail, which is, quite the onerous sort of planning.
And
Is there
that's
any
the
other-
next step in the engagement process, is to work with our community members, persons that use drugs to get feedback from them about where would be most viable.
Can you give us a rough timeline, how long this takes? And is this the first time a mobile center like this has been done in BC or maybe even Canada?
Yeah, as far as we know, BC, this is the first time that BC is applying for a mobile service. So it is an innovation. This service does not exist in Canada or in North America for as long as we know. There is no supervised consumption being offered in BC or in Canada that we know of.
How is this different than what's happening in Vancouver and the downtown east side?
Yeah, so the downtown east side is different from what we have in Kelowna because the downtown east side concentrates a large number of peers or people who use drugs. We don't have that amount of the number of people who use drugs here in Kelowna is nowhere near the downtown east side. So that's the other consideration. Do we need a fixed location when we don't have that amount? We're not going to have that many clients for that particular location. So is it worth, the having that? And as we said, the community consultation also led us to believe that the mobile is the best option.
But the mobile units they have out in Vancouver right now, how will this one that you're applying for be different than those?
Yeah, so what the mobiles are that are available in the downtown east side, I understand are there to provide medical services, acting more like an overdose prevention site. And that's definitely something we could consider. So one important aspect is that mobile harm reduction exists. There is lots of places, including the interior. I understand in Nelson there is mobile harm reduction. So that means a van or a car could go out and meet peers where they are and provide clean needles or provide take-home naloxone. That is not new. That exists, and that's something that we are going to have. This mobile will be providing harm reduction services. So that's in my opinion, great news to be able to have an outreach mobile service that can go to Rutland or downtown when Ellis is closed or when other agencies are closed. So that's one thing. That's something we are planning to have, the mobile harm reduction, and what we are doing is applying for an exemption to be able to use drugs in that mobile. So if this is a bigger, if you can imagine, now we are a bigger mobile where people can come in and use their drugs in there. That's the application.
How
Supervised
exactly-
injection,
Yes.
supervised consumption then?
Yeah, but if we have a, say, if Health Canada was to reject the application, we could still end up with a mobile harm reduction, and that is a benefit to the city.
So we could call this a mobile supervised consumption or supervised injection site.
Yes, that's what we are aiming for through the application.
Did you address how long you thought it would take?
For the application
Or
to.
just the timeline, rough timeline?
Wait,
A
we're-
year, 2 years? a
We
month?
have no idea. The last one that went through from Health Canada for the Dr. Peters Center actually took a couple years. There have been other communities that have submitted to Health Canada. They haven't heard back, so we don't know.
Do you think that it being a mobile site makes that process more complicated? Maybe we'll make it take longer?
It's really at this point unknown. It may make it faster, who knows?
Do we have an idea of budget, how much that might cost taxpayers?
We're working through that right now.
Yeah, we are working through the cost, and regarding the timelines, we would hope that as soon as possible. We would hope to hear from Health Canada as soon as possible because this is a service that is needed.
Yeah.
We don't know how long it's going to take for them to get back to us. We would hope that it's less than years.
How many staff members will be running it? And who will be running it?
At this point, we're looking at 2 staff members. One would certainly be a nurse, and one would be, I don't know if it's a mental health worker or someone who could provide substance use counseling. And really, the intent is to start to bring people into care as well. So we will be providing some form of primary care nursing services, but also supporting people for when they're ready to either stop using drugs or need more support.
Now, how will the mobile site know which stops to go to? Will it travel around all day long, or how often will it move?
That's part of our consultation process.
Yeah.
Now that we've announced that we're going out with a mobile option, the next step is to say, where's the most appropriate spot for it to be? Letting both the user group and the community and our data guide us. So we may start out with sites that where the hotspots are, and that may change over time.
Can you guys talk about, because technically you guys already have overdose prevention site, I sometimes forget the names of all of these, overdose prevention site in Kelowna. Can you talk about how it's been already in this last month, if it's been pretty successful so far, and also maybe if there's any word on a Rutland location potentially? I know
Yeah.
you're not really here to talk about that.